Hello, I'm Dr. Anthony Wheeler, and I'm telling you everything that you need to know about pathology, even what's going on in this image. This is some severe pitting edema. Patient likely has congestive heart failure. How would you grade this edema here? 0 plus, 1 plus, 2 plus, 3 plus, or 4 plus? I would grade it as 4 plus, right? Because respectively, 0 plus, 1 plus, 2 plus, 3 plus, and 4 plus corresponds to 0 millimeters, 2 millimeters, 4 millimeters, 6 millimeters, and 8 millimeters in depth. That's why I would think this is 4 plus, because it looks deep. We're going to be talking about heart failure pathology. All of this is in your book, Medical School Pathology and Step 1 Review. You have this because you're not a procrastinator. You're going to succeed on Step 1, not like those unfortunate souls who don't have this, relying on old, outdated material, who are going to suffer and not succeed. Unlike you. You're a star because you're ahead of the game. And I'm going to make sure you have everything that you need to know, starting with this, okay? Congestive heart failure. Congestive heart failure is pump failure of the heart. Simple, right? All you radiologists or future radiologists, here we have an ultrasound showing severe systolic heart failure. Congestive heart failure is divided into left-sided heart failure or right-sided heart failure. And here again, how would you grade this edema? Okay. Also keep in mind that the radiology may show curly B lines from acute cardiac decompensation, and those specifically are the short horizontal lines that can be found everywhere on a chest x-ray. You can see this here happening in the right lung. Another classical symptom of heart failure, specifically congestive heart failure, is an exceedingly elevated JVP, jugular venous pulse. You can see that marked here with the arrow. And for all you future pathologists out there with your microscopes, here is a histologic assessment from a patient that has cyanosis with that arrow that's showing it, and pulmonary congestion, indicating, further supporting, diagnosing left congestive heart failure. Risk factors for left-sided heart failure include myocardial infarction, ischemia, hypertension, dilated cardiomyopathy, and restrictive cardiomyopathy. Clinical features of left-sided heart failure include pulmonary congestion, dyspnea, paroxysmal nocturnal dyspnea, and this is due to the increased venous return when lying flat, orthopnea, and cyanosis. Small congested capillaries can actually burst, resulting in intra-alveolar hemorrhage. Left-sided heart failure histology shows marked by hemosiderin-laden macrophages. Those are called the heart failure cells. So again, in a patient with left-sided heart failure, you may see heart failure cells, those pigment-laden macrophages, and that pigment is hemosiderin. Reduced flow to the kidneys results in activation of the renin-angiotensin system, which increases the blood pressure. Fluid retention exacerbates congestive heart failure. And ACE inhibitor therapy is the mainstay of treatment. Now let's move on to right-sided heart failure. Causes of right-sided heart failure include, most commonly, left-sided heart failure, right? There's always a trick question that's asked about that. So remember, the most common cause of right-sided heart failure is left-sided heart failure. Other things that can cause right-sided heart failure include chronic lung disease and a left-to-right shunt. Clinical features of right-sided heart failure are secondary to congestion and include edema, jugular venous distension, and hepatosplenomegaly. And with that, I bid you adieu. Great job. This was a light one and an easy one, a breather one. But the material is very important, so make sure you have it down. Keep studying. Everything is fair game, and I'll continue to point out what's good. If you have any questions, comments, or concerns, let me know. Reach out to me, leave a comment, make sure you're subscribed or whatever. Do what you need to do to make sure you don't lose access to these presentations. And with that, adios.